A new warning today about Canada's rapidly aging population. Ontario is being urged to hire thousands of personal support workers by 2028 to meet the growing demand. CTV's Tony Grace is joining us now with the latest on this. And Tony, let's talk a little bit about this survey and what they found. Some frightening numbers.
Yeah, absolutely, Roger. Researchers from Ontario's McMaster University were carrying out this study for Home Care Ontario. That's an umbrella group that represents a variety of home care agencies. Look, here are the takeaways. By 2029, the portion of the population over the age of 65 in Ontario is expected to jump by around 650,000 people. That's a 23% jump. And the proportion of those over 75 is expected to jump by 27%, or another 350,000 seniors. Translation, the study says that another 6,800 additional personal support workers will be needed in the next 5 years or so just to maintain home care service levels. Now, Roger, this comes at a time when advocates across the sector have been calling for additional investments. They've been underscoring staffing shortages that were certainly exacerbated during the pandemic, but also that have persisted for periods of time after, as well as the sector has moved away from pandemic measures. And it's a sector that's been struggling to attract new workers. A lot of unions are saying that's because of wages. They've been calling, the advocates have, for the government to invest more in the sector. The Ontario government promised in the order of $1 billion in new money for the sector, but Home Care Ontario, this advocacy group, says that only a fraction of that has actually made its way into the hands of the agencies who need it to provide those services for an aging population. And Roger, with Ontario's population forecast to keep booming in the next 5, 10, 15 years, of course, it becomes all the more urgent, according to those who are advocating for change here.
And many people, this should be a concern for all of us when it comes to this, because it has a ripple effect on hospitals.
It certainly does. And when you talk about the situation with hospitals in Ontario, certainly this has been seen in other provinces as well, but it's been underscored in Ontario. There have been more than 200 situations in the last couple of years where emergency rooms have had unplanned closures, sometimes for a number of hours, sometimes overnight, sometimes for a weekend. That often means people having to drive 15, 20, 30 minutes to the next hospital. But if you talk about an aging population that may require those emergency rooms even more often in the absence of home care services, well, that's where advocates are saying that this is setting off a real alarm bell here. So the ripple effect possibly on a hospital system where it's more expensive per patient to care for a patient in an emergency setting, to give a patient treatment through the auspices of an emergency department, versus home care services that could go a long way toward prevention in the long term. So it's a real mix of red flags here, Roger, being thrown at a time when the population of the province and the country is expected to swell.
Okay, CTV's Tony Grace, thank you for that update.
Thank you.